Hi, good evening, everybody. I'm Dr. Bobby back on behalf of New Age Cosmetic White EdTech Healthcare Consultancy. Today's topic is on cancer. And since this is a very important topic, I'm using the official website of the United States government as my major reference, along with the subject matter proper. So I'm taking references from the National Cancer Institute, NIH. So I'll be speaking on each aspect that's mentioned here about cancer, about diagnosis and staging, and related aspects. So please take notes and use it as a reference. To all those students who can't afford to get such extensive material, you're most welcome. But please avoid copying the matter or trying to sell any such aspects. Do not commercialize this. I'm just using it purely for the educative purpose, in the best interest of all students aspiring for exams and higher studies and research. You may please refer to this lecture, make your notes, and I wish you all the best. So we're talking about cancer, which is the first topic, right? Now, when we go to the matter proper, so this is a picture of the doctor taking care of the patient, convincing and mellowing patients, giving them more confidence and a sense of direction, a sense of self-confidence, a sense of more respect, and to allay or mitigate all fears, right? So the science-based information you can trust. It's coming from a leading center, the National Cancer Institute. Thank you, sirs, courtesy to them for this wonderful message and details on what we're going to study. So what is cancer? Right? Now, on this, we have the definition of cancer. So cancer is basically a disease which some of the body cells grow uncontrollably and spread to other parts of the body. This picture that you see here, right? And this picture here, this is a dividing breast cancer cell, which is an important photograph that you may wish to see, which is being produced by the National Cancer Institute and the University of Pittsburgh Cancer Institute. Courtesy to them. Thank you, sirs. Please make notes of these for your future references. You could be even a great help to those who wish to have more info on such matters, right? Right. Now, cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place, right? Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumors, which are lumps of tissue, right? Tumors can be cancerous or not cancerous, benign. Cancerous tumors spread into or invade nearby tissues and can travel to distant places in the body to form new tumors, a process called metastasis. Cancerous tumors may also be called malignant tumors. Many cancers form solid tumors, but cancers of the blood, such as leukemias, generally do not. Right? Benign tumors do not spread into or invade nearby tissues when removed. Benign tumors usually don't grow back, whereas cancerous tumors sometimes do. Benign tumors can sometimes be quite large, however, some can cause serious symptoms or be life-threatening, such as benign tumors in the brain. Now, reading out the matter to you from an institute's perspective, and their narrative would be the reason that the language is more understandable. It isn't too complex, so even a layman can understand. But for students into this subject, this kind of explanation helps you a lot. So please listen attentively and make your notes. The differences between cancer cells and normal cells. Cancer cells differ from normal cells in many ways. For instance, cancer cells grow in the absence of signals telling them to grow. Normal cells only grow when they receive such signals. I hope you understand that point. Cancer cells, they grow in the absence of signals telling them to grow, which is they're out of control. So normal cells only grow when they receive such signals. Ignore signals that normally tell cells to stop dividing or to die, a process known as programmed cell death or apoptosis. Okay, cancer cells ignore signals that normally tell cells to stop dividing or to die. Cancer cells invade into nearby areas and spread to other areas of the body. Normal cells stop growing when they encounter other cells, and most normal cells do not move around the body. Cancer cells tell blood vessels to grow toward tumors. These blood vessels supply tumors with oxygen and nutrients and remove waste products from tumors. Cancer cells hide from the immune system. The immune system normally eliminates damaged or abnormal cells. They trick the immune system into helping cancer cells stay alive and grow. For instance, some cancer cells convince immune cells to protect the tumor instead of attacking it. Accumulate multiple changes in the chromosomes, such as duplications and deletions of chromosome parts. Some cancer cells have double the normal number of chromosomes. They rely on different kinds of nutrients than normal cells. In addition, some cancer cells make energy from nutrients in a different way than most normal cells. This lets cancer cells grow more quickly. Many times, cancer cells rely so heavily on these abnormal behaviors that they can't survive without them. So researchers have taken advantage of this fact, developing therapies that target the abnormal features of cancer cells. For example, some cancer therapies prevent blood vessels from going towards tumors, essentially starving the tumor of needed nutrients. So let's read on that. Prevent blood vessels from growing towards the tumors. So this is about focusing on something called angiogenesis inhibitors. So on this page, so we go with all details step by step, right? So on this page, what is angiogenesis? Angiogenesis is the formation of new blood vessels. This process involves the migration of growth and differentiation of endothelial cells, which line the inside wall of blood vessels. So the process of angiogenesis is controlled by chemical signals in the body. Some of these signals, such as vascular endothelial growth factor, VEGF, bind to receptors on the surface of normal endothelial cells. When VEGF and other endothelial growth factors bind to their receptors on endothelial cells, signals within these cells are initiated that promote the growth and survival of new blood cells. Other chemical signals called angiogenesis inhibitors interfere with blood vessel formation. Normally, the angiogenesis stimulating and inhibiting effects of these chemical signals are balanced so that blood vessels form only when and where they are needed, such as during growth and healing. But for reasons that are not entirely clear, sometimes these signals can become unbalanced, causing increased blood vessel growth that can lead to abnormal conditions or disease. For example, angiogenesis is the cause of age-related wet macular degeneration. Why is angiogenesis important in cancer? Angiogenesis plays a critical role in the growth of cancer because solid tumors need a blood supply if they are to grow beyond a few millimeters in size. Tumors can actually cause this blood supply to form by giving off chemical signals that stimulate angiogenesis. Tumors can stimulate nearby normal cells to produce angiogenesis signaling molecules. The resulting new blood vessels feed growing tumors with oxygen and nutrients, allowing tumors to enlarge and the cancer cells to invade nearby tissues, to move throughout the body, and to form new colonies of cancer cells called metastasis. Because tumors cannot grow beyond a certain size or spread without a blood supply, scientists have developed drugs called angiogenesis inhibitors, which block tumor angiogenesis. The goal of these drugs, also called anti-angiogenic agents, is to prevent or slow the growth of cancer by starving it of its needed blood supply. So how do angiogenesis inhibitors work? Angiogenesis inhibitors are unique cancer-fighting agents because they block the growth of blood vessels that support tumor growth rather than blocking the growth of tumor cells themselves. So angiogenesis inhibitors interfere in several ways with various steps in blood vessel growth. Some are monoclonal antibodies that specifically recognize and bind to VEGF. When VEGF is attached to these drugs, it is unable to activate the VEGF receptor. Other angiogenesis inhibitors bind to VEGF or its receptor as well as to other receptors on the surface of endothelial cells or to other proteins in the downstream signaling pathway, blocking the activities. Some angiogenesis inhibitors are immunomodulatory drugs, agents that stimulate or suppress the immune system that also have an anti-angiogenic properties. In some cancers, angiogenesis inhibitors appear to be most effective when combined with additional therapies because angiogenesis inhibitors work by slowing or stopping tumor growth without killing cancer cells. They are given over a long period. What angiogenesis inhibitors are being used to treat cancer in humans? All right, the U.S. Food and Drug Administration, FDA, has approved a number of angiogenesis inhibitors to treat cancer. Most of these are targeted therapies that were developed specifically to target VEGF, its receptor, or other specific molecules involved in angiogenesis. Approved angiogenesis inhibitors include, you can take a note of these drugs, axitinib, enlital, it's registered, bevacizumab, Avastin, that's the company name, the generic name and the company name, right? And you would say it as the brand name. Cabozantinib, Bacometric, everolimus, Afinitor, lenalidomide, lenvatinib, mesylate, pazopanib, ramucirumab, regorafenib, sorafenib, cimtinib, thalidomide, vandetanib, and aflibercept. So just let's look at one of those drugs. Right? So this page contains brief information about the aflibercept and a collection of links to more information about the use of this drug, research results, and ongoing clinical trials. This is exactly how they expect you to understand. So you need to know the details of each drug that you use. The US brand names Eylea and Zaltrap, FDA approved, yes. The FDA label information for this drug is available at the Daily Mint. So when you buy a drug, ask for the drug information. How is it used in cancer? Aflibercept is approved to be used with FOLFIRI to treat colorectal cancer that has metastasized, spread to other parts of the body. It is used in patients whose disease has not gotten better with other chemotherapy. So this drug is also being studied in treatment of other types of cancer. More about this, detailed scientific definition, other names for this drug. Medline Plus information on aflibercept, a lay language summary of important information about this drug that may include the following: warning about this drug, what this drug is used for and how it is used, what you should tell your doctor before using this drug, what you should know about this drug before using it, other drugs that may interact with this drug, and possible side effects. Drugs are often studied to find out if they can help treat or prevent conditions other than the ones they are approved for. This patient information sheet applies only to approved users of the drug. However, much of the information may also apply to unapproved users that are being studied. Research results and related resources. So that takes care of targeted cancer therapies. So what's that about? Now, targeted cancer therapy to treat cancer. So on this page, what is targeted therapy? So we're going in depth. Okay. Targeted therapy is a type of cancer treatment that targets proteins that control how cancer cells grow, divide, and spread. It is the foundation of precision medicine. As researchers learn more about the DNA changes and proteins that drive cancer, they are able to design treatments that target these proteins. Okay, now, while I'm reading this, I hope you remember the previous portion on cell biology, about infection and about cancer cell communication and signaling. So here we're talking about, this is all about cancer cell signaling and communication. It's about the tumor cells giving the wrong information and the healthy cells working only on the right information, you see. So that way you correlate those notes on the previous lectures to the present lecture, because all cancer, the study of this cancer and this lecture has a lot to do with all the previous chapters on cell communication and signaling, okay, and cell biology. So there's topics in that particular aspect where we have done most host parasite interactions and the recognition of various aspects of it, cell signaling, cellular communication, and now we're on cancer. And after this would be innate and adaptive immune systems after this, right? So relate and correlate the subjects that are being taught to you that I'm lecturing on, so it helps you get a continuity. What are the types of targeted, did we miss out any points there? It is the foundation of precision medicine. As researchers learn more about the DNA changes and proteins that drive cancer, they are better able to design treatments that target these proteins. So yesterday I was talking a lot. We have various aspects in this, host parasite interactions, and about how the cell-based infection process happens, okay, and how what all the commensal effects, various about cells that are helpful, cells that are not affect the infective part, the commensal part. There are so many things that you need to relate, correlate, understand, because just reading a topic is not going to help. That's why I've gone, now I'm in the third or fourth layer of lecture. So this lecture has various layers of understanding. So you have to listen carefully, right? So as you're reviewing and studying and listening to the lecture, please go to the transcript, which is there by YouTube. Thank you to give a big thanks to YouTube for transcript of what's being read out, because you get to know what's there. So even after reading that, you have some doubts, please post your doubts, queries and clarifications required on the comment section, and I shall get back to you with specific and clear details on each and every question that you would have, right? So the next thing is, what are the types of targeted therapy? Most targeted therapies are either small molecule drugs or monoclonal antibodies. Small molecule drugs are small enough to enter cells easily, so they're used for targets that are inside cells. Monoclonal antibodies, right? Also known as therapeutic antibodies, are proteins produced in the lab. These proteins are designed to attach to specific targets found on cancer cells. Some monoclonal antibodies mark cancer cells so that they will be better seen and destroyed by the immune system. Other monoclonal antibodies directly stop cancer cells from growing or cause them to self-destruct. Still others carry toxins to cancer cells. Learn more about monoclonal antibodies. We're going to the next layer, right? So monoclonal antibodies. How do monoclonal antibodies work against cancer? See, this way of learning, you get to understand the subject, you get to learn more, rather than going for the stereotype textbook kind of learning, right? This kind of lectures is what you need. So we'll try to focus on this kind of teaching and studies from henceforth, right? So how do monoclonal antibodies work against cancer? Monoclonal antibodies are immune system proteins that are created in the lab. Antibodies are naturally by your body and help the immune system recognize germs that cause disease, such as bacteria and viruses, and mark them for destruction. Like your body's own antibodies, monoclonal antibodies recognize specific targets. So natural antibodies and monoclonal antibodies are different in the sense monoclonal antibodies are made in the lab, created there. So we would call it artificial, or we would call it designed for a better purpose. Let's put it that way. Many monoclonal antibodies are used to treat cancer. They are a type of targeted cancer therapy, which means they are designed to interact with specific targets. Learn more about targeted therapy. I think we just read on that. So let's finish the subject. Then we go back. If there are no further references, we go back to the former layer, then the former layer, then the former layer, and then to the start. All right. Otherwise, any other references, we go forward on the next layer, and the next layer, and the next layer. Right. Some monoclonal antibodies are also immunotherapy because they help turn the immune system against cancer. For example, some monoclonal antibodies mark cancer cells so that the immune system will be better recognized and it destroys them. An example is rituximab, which binds to a protein called CD20 on the B cells and some types of cancer cells, causing the immune system to kill them. B cells are a type of white blood cell. Other monoclonal antibodies bring T cells closer to cancer cells, helping the immune cells kill the cancer cells. An example is blinatumomab. It's pretty tough to pronounce, but learn to pronounce it. The brand name is easier, but I'm specifically written out the generic name so that you need to remember that it's not the brand that counts, it's the content that counts. Could be a good brand, could be a bad brand. I mean, you can't say brands are bad because they're only marketing a product through their names, but the generic version of it, what exactly is it, is what matters, right? So, blinatumomab, branded as Blincyto, registered, which binds to both CD19, a protein found on the surface of leukemia cells, and CD3, a protein on the surface of T cells. This process helps the T cells get close enough to the leukemia cells to respond to and kill them. This is a diagram illustration of that. You could take a screenshot or a copy for your educative exam purposes only, please. Cancer cell, you have a T cell, you have a monoclonal antibody, right? Some monoclonal antibodies bring T cells close to cancer cells, helping them kill cancer cells. Credit National Cancer Institute. Thank you. Which cancers are treated with monoclonal antibodies? Many monoclonal antibodies have been approved to treat a wide variety of cancers. To learn about specific treatment for your cancer, see the PDQ, registered, right? Adult cancer treatment summaries and childhood cancer treatment summaries. We're going to that. Adult cancer treatment summaries. So what's that? The alphabetic list of PDQ is adult cancer treatment summaries. These are all the names. So acute lymphoblastic leukemia. May repeat that. Acute lymphoblastic leukemia, patient, health professional. So what's that about? Patient. So a patient with this, what's it going to be like? Go to health professional version. On this page, general information about acute lymphoblastic leukemia. All right. So going to the acute lymphoblastic leukemia treatment, PDQ health professional version. You have the patient version and you have the professional version. Right, we were talking on the patient version. So let's go to patient version first. Listen to what the patient has to say or what we know about the patient. Acute lymphoblastic leukemia treatment, PDQ, patient version. Okay, so we have general information about acute lymphoblastic leukemia. We read the details on that. And the key points in acute lymphoblastic leukemia, ALL, is a type of cancer in which the bone marrow makes too many lymphocytes, a type of white blood cell. Leukemia may affect red blood cells, right? And white blood cells and platelets, right? And previous chemotherapy and exposure to radiation may increase the risk of developing ALL. Signs and symptoms of ALL include fatigue, fever, and easy bruising or bleeding. Tests that examine the blood and bone marrow are used to diagnose ALL. After ALL has been diagnosed, these tests are done to find out if the cancer has spread to the central nervous system, brain, and spinal cord, or to other parts of the body. Some people desire to get a second opinion. Certain factors affect prognosis, chance of recovery, and treatment options. Acute lymphoblastic leukemia, ALL, is a type of cancer in which the bone marrow makes too many lymphocytes, a type of white blood cell. Okay, so ALL is a cancer of the blood and bone marrow. That this type of cancer usually gets worse quickly if it is not treated. So this is a picture of that. It's in the bone marrow. Take notes, understand it better, right? And right. This is for your understanding. This is trying to focus on the picture. Right? Anatomy of the bone. The bone is made up of compact bone, spongy tissue, and bone marrow. Compact bone makes up the outer layer of the bone. Spongy bone is found mostly at the ends of bones and contain red marrow. Bone marrow is found in the center of most bones and has many blood vessels. There are too many types of bone marrow. There are two types of bone marrow, red and yellow. Right? I'll read out that again for you. Spongy bone is found mostly at the ends of bones and contain red marrow. Bone marrow is found in the center of most bones and has many blood vessels. There are two types of bone marrow, red and yellow. Red marrow contains blood stem cells that can become red blood cells, white blood cells, or platelets. Yellow marrow is made mostly of fat. Leukemia may affect red blood cells and white blood cells and platelets. The bone marrow and thymus make blood stem cells, immature cells that become mature blood cells over time. A blood stem cell may become a myeloid stem cell or a lymphoid stem cell. A blood stem cell may become a myeloid stem cell or a lymphoid stem cell. Remember that point. Because, stem cells later on go under morphogenesis or differentiation to become various kinds of cells. Right? A lymphoid stem cell becomes a lymphoblast cell and then one of three types of lymphocytes, white blood cells. So, from the lymphoid stem cells, you get the various lymphoblast cells and the lymphocytes. So this is how we correlate, because when you read the subject matter proper, you only get to know that you're just reading something, but you're not sure what exactly, white blood cells, that's it. So where does it come from? How does it happen? So these all have stem cells that give rise, right? So that's a basic you should know. So reading this way, getting to know on disease and what happens there, you get to know your basics much better. So B lymphocytes that make antibodies to help fight infection. T lymphocytes that help B lymphocytes make the antibodies that help fight infection. Natural killer cells that attack cancer cells and viruses. This is a picture of the various stages. From blood stem cells, you get myeloid stem cells, you get lymphoid stem cells. From the myeloid stem cells, you get myeloblasts and red blood cells, So the myeloblasts, they give to granulocytes, eosinophilia, basophilia, neutrophils, and the platelets, all from myeloid stem cell. So next time your teacher asks you, tell me about the white blood cells, you need to say, they arise from myeloid stem cells, Basic blood stem cell, it has two varieties, myeloid stem cell and lymphoid stem cell. And lymphoid stem cell, you have lymphoblast, which has B lymphocyte, T lymphocyte, and natural killer cells. All these, from the myeloblast, all those combinations, and from the lymphoblast, these combinations, these are all together forming the white blood cell. There are many out there, right? So you got to know these details. And apart from that, you have the platelets and you have the red blood cells, right? So remember the diagram. This single diagram can fetch you a lot of marks. You get to understand the subject matter proper. So blood cell development. A blood stem cell goes through several steps to become a red blood cell, platelet, or white blood cell. In all, too many stem cells become lymphoblasts, B lymphocytes, or T lymphocytes. These cells are also called leukemia cells. Leukemia cells are not able to fight infection very well. Also, as the number of leukemia cells increases in the blood and bone marrow, there is less room for healthy white blood cells, red blood cells, and platelets. This may cause infection, anemia, and easy bleeding. The cancer can also spread to the central nervous system, brain and spinal cord, lymph nodes, spleen, liver, testicles, and other organs. Previous chemotherapy and exposure to radiation may increase the risk of developing ALL. Now, ALL is caused by certain changes to the way blood stem cells function, especially how they grow and divide into new cells. A risk factor is anything that increases the chance of getting a disease. Some risk factors for cancer, like smoking, can be changed. However, risk factors also include things people cannot change, like their genetics, getting older, and their health history. There are many risk factors for all, but many do not directly cause cancer. Instead, they increase the chance of DNA damage in cells that may lead to ALL. Learn more about how cancer develops and what is cancer. Right? Having one or more of these risk factors does not mean that you will get all ALL. Many people with risk factors never develop ALL, while others with no risk factors do. Possible risk factors for ALL include being male, being white, being older than 70, past treatment with chemotherapy or radiation therapy, being exposed to high levels of radiation in the environment, such as nuclear radiation, having certain genetic disorders such as Down syndrome. So talk with your doctor if you think you may be at risk. Signs and symptoms of ALL include fatigue, fever, and early bruising or bleeding. See, when you go in as a student, because these chapters of teaching are for fresh candidates. So you go and you see what's a sign, what's a symptom. So when you get to hear the disease clearly, the signs and symptoms to all ALL include fatigue, fever, and easy bruising or bleeding. So you listen to these lectures, you get to know what signs, what are symptoms, and how to express yourselves to the examiners, to your teachers, and to your patients in particular. Right? The early signs and symptoms of ALL may be like the flu or even other common disease. Check with your doctor if you have. Weakness or fatigue, fever or drenching night sweats, easy bruising or bleeding, petechiae, flat pinpoint spots under the skin caused by bleeding, shortness of breath, weight loss or loss of appetite, pain in the bones or stomach, pain or feeling of fullness below the ribs, painless lumps in the neck, underarm, stomach, or groin, and frequent infection. These and other signs and symptoms may be caused by ALL or other conditions. Tests that examine the blood and bone marrow are used to diagnose ALL. So lab tests, what are they about? So, in addition to asking about your personal and family health history and doing a physical exam, your doctor may perform the following tests and procedures. Complete blood count, that's CBC, with differential. And complete blood cell CBC with differential is a procedure in which a sample of blood is drawn and checked for the number of red blood cells and platelets, the number and type of white blood cells, the amount of hemoglobin, the substance that carries oxygen in the red blood cells, the amount of hematocrit, whole blood that is made up of red blood cells. So you see the doctor or the lab assistant taking out blood from your veins. There, the blood has plasma, white blood cells, platelets, and red blood cells. They study this for the variations and differences, right? And those details of lab details are coming up. We study them as you see the procedures going on, right? So complete blood cell, CBC. Blood is collected by inserting a needle into a vein and allowing the blood to flow into a tube. The blood sample is sent to the laboratory and the red blood cells, white blood cells, and platelets are counted. The CBC is used to test for, diagnose, and monitor many different conditions. Blood chemistry study. It is a laboratory test in which a blood sample is checked to measure the amount of certain substances released into the blood by organs and tissues in the body. An unusual higher or lower than normal amount of a substance can be a sign of disease. Peripheral blood smear is a laboratory test in which a sample of blood is checked for blast cells, the number of kinds of white blood cells, the number of platelets, and changes in the shape of blood cells. Bone marrow aspiration biopsy is the removal of bone marrow, blood, and a small piece of bone by inserting a hollow needle into the hip bone or breastbone. A pathologist views the bone marrow, blood, and bone under a microscope to look for abnormal cells. See, they show the procedure. This is how they do it. Bone marrow needle, bone marrow, skin, and hip bone. So following these lectures, you'll be one of the most updated students, right? So be happy make the best use of it, right? Bone marrow aspiration and biopsy. After a small area of skin is numbed, a long hollow needle is inserted through the patient's skin and hip bone into the bone marrow. A sample of bone marrow and a small piece of bone are removed for examination under microscope. The following tests may be done on the samples of blood or bone marrow tissue that are removed. Cytogenetic analysis. This checks the chromosomes of cells in a blood or bone marrow sample for changes such as broken, missing, rearranged, or extra chromosomes. Changes in certain chromosomes may be a sign of cancer. For example, in Philadelphia chromosome, positive ALL part of one chromosome switches places with part of another chromosome. This is called the Philadelphia chromosome. Cytogenetic analysis is used to help diagnose cancer, plan treatment, or find out how well the treatment is working. So enlarge Q, that's the, wait, I think it's a brand name. So anyway, this is the picture of how it's being done. See, right? I mean, the details of the picture. Philadelphia, the normal chromosome, number 9, ABL gene, normal chromosome 22, BCR gene, the chromosome break. And then the changed chromosome 22, Philadelphia chromosome, and the PCR ABL fusion gene. Now, the Philadelphia PH chromosome is an abnormal chromosome that is made when pieces of chromosomes 9 and 22 break off and trade places. The ABL gene from chromosome 9 joins to the BCR gene on chromosome 22 to form the BCR. The ABL fusion gene, the changed chromosome 22 with the fusion gene on it, is called the PH chromosome. Immunophenotyping. Let me repeat that. Immunophenotyping uses antibodies to identify cancer cells based on the types of antigens or markers on the surface of the cells. This test is used to help diagnose specific types of leukemia. For example, cytochemistry study may test the cells in a sample of tissue using chemicals dyes to look for certain changes in the sample. A chemical may cause a color change in one type of leukemia cell but not in another type of leukemia cell. After ALL has been diagnosed, tests are done to find out if the cancer has spread to the central nervous system, brain, and spinal cord, or to other parts of the body. The following tests and procedures may be used to find out if the leukemia has spread outside the blood and bone marrow. So as I read, each term matters to you. Note it down. Chest X-ray, lumbar puncture. See the former words that I've used, immunophenotyping. You need to write all these down and make a note and remember these terminologies, right? That's the reason I gave you what you call a lexicon kind of reference about parasitic infection. I'll put that up in the next lecture as a lexicon. Reference to the National Library of Medicine has put up a lexicon, a medical lexicon. In fact, it's called a specialist lexicon. You could use that as a reference of all terms and terminologies. I'll put that up, shortly after this lecture is over. Where the chest X-ray is a type of radiation that can go through the body and make pictures of the organs and bones inside the chest. Lumbar puncture is a procedure used to collect a sample of cerebrospinal fluid, CSF, from the spinal column. This is done by placing a needle between two bones in the spine and into the CSF around the spinal cord and removing a sample of the fluid. The sample of CSF is checked under a microscope for signs that leukemia cells have spread to the brain and spinal cord. This procedure is also called an LP or spinal tap. So somebody asks what a spinal tap? You know what to tell. You know where to read this from. My lectures are there for your assistance always. Make the best of them. Lumbar puncture. Next to the spinal cord, you have the spinal fluid and the spinal needle. That's the spinal tap. All right? What do we say? This procedure is all called an LP, lumbar puncture or a spinal tap. That could be a question for the MCQ as well. So lumbar puncture, a patient lies in a curved or curled position on a table. After a small area of the lower back is numbed, a spinal needle, a long thin needle, is inserted into the lower part of the spinal column to remove CSF, cerebrospinal fluid, as shown in blue. See, this is blue. The fluid may be sent to a lab for testing. Next is a CT scan or CAT scan. Uses a computer linked to an X-ray machine to make a series of detailed pictures of areas inside the bone. such as the abdomen. The pictures are taken from different angles and are used to create 3D views of tissues and organs. A dye may be injected into a vein or swallowed to help the organs or tissues show up more clearly. This procedure is also called computed tomography, computerized tomography, or computerized axial tomography. They all mean the same. The next will be MRI, the latest, one among the latest. So magnetic resonance imaging uses a magnet, radio waves, and a computer to make a series of detailed pictures of areas inside the body. This procedure is also called nuclear magnetic resonance imaging and MRI. Some people decide to get a second opinion. You may want to get a second opinion to confirm your ALL diagnosis and treatment plan. If you seek a second opinion, you will need to get medical test results and reports from the first doctor to share with the second doctor. The second doctor will review the pathology reports, slides, and scans. They may agree with the first doctor, suggest changes or another treatment approach, or provide more information about your cancer. To learn more about choosing a doctor and getting a second opinion, see Finding Cancer Care. This is about the treatment aspect in the US. That's one, we can just have a look at that. Finding Cancer Care. So they give you references on whom to go to and what to do and all that. Finding Cancer Care here. If you have been diagnosed with cancer, finding a cancer doctor and a cancer center or hospital for your cancer care is an important step to getting the best treatment possible. You will have many things to consider when choosing a cancer doctor. It's important for you to feel comfortable with the person you choose because you will be working closely with them to make decisions about your cancer treatment. On this page, choosing a cancer doctor, finding a cancer doctor, getting a second opinion after cancer diagnosis, choosing a cancer center or hospital, find health insurance and home care services. Now, choosing a cancer doctor. An oncologist is a doctor who has special training in diagnosing and treating cancer. So when choosing a doctor for your cancer care, it may be helpful to know some of the terms used to describe a doctor's training and credentials. Most physicians who treat people with cancer are medical doctors. They have an MD degree. Or osteopathic doctors, they have a DO degree. Standard training includes 4 years of study at a college or university, 4 years of medical school, 3 to 7 years of postgraduate medical education through internships and residencies. Doctors must pass an exam to become licensed to practice medicine in their state. So you need that much to be an oncologist. So for those of you preparing for much higher studies, here are some details there. The details you need. Specialist doctors who have done their residency training in a specific field such as internal medicine, independent specialty boards, certified physicians after they have met needed requirements such as meeting certain education and training standards, being licensed to practice medicine, and passing an exam given by the specialty board. Once they have met these requirements, physicians are said to be board certified. Besides oncologists, other specialists who treat cancer include hematologists, focus on disease of the blood and related tissues, including the bone marrow, spleen, and lymph nodes. Radiation oncologists use X-rays and other forms of radiations to diagnose and treat disease. Surgeons perform operations on almost any area of the body and may specialize in a certain type of surgery. Finding a cancer doctor. To find an oncologist, ask your primary care doctor to suggest someone, or you may know of a specialist through the experience of a friend or family doctor. Also, your local hospital should be able to provide you with a list of oncologists who practice there. Another option for finding a doctor is your nearest NCI, National Cancer Institute Designated Cancer Center. The Find a Cancer Center page provides contact information to help healthcare providers and cancer patients with referrals to all NCI designated cancer centers in the United States. So similar things are happening in India too. Some organizations have online directories that may help you to find a cancer doctor. Some examples are below: the American Board of Medical Specialties, the American College of Surgeons, the American Medical Association, the American Osteopathic Association, the American Society of Clinical Oncology. You can take all of these references, right? So all these things have been there to help make your decision when you're considering what doctor to choose. Think about whether that doctor has the education training needed to meet your needs, has someone who covers for them if they are unavailable, and who would have access to your medical records, and who would have access to your medical records, has a helpful support staff, explains things clearly, listens to you and treats you with respect, encourages you to ask questions, has office hours that meet your needs, is easy to get an appointment with, uses telemedicine when visits don't need to be in person. If you've chosen a surgeon, you will want to ask questions such as being listed below, as these listed below. Are they both certified? How do they perform the type of surgery you need? How many of these procedures have they performed? And what hospital do they practice? It's important for you to feel good about the cancer doctor you choose. You will be working with this person closely as you make decisions about your cancer treatment. Getting a second opinion after a cancer diagnosis, right? Now, after you talk to a doctor about the diagnosis and treatment plan for your cancer, you may want to get another doctor's opinion before you begin treatment. This is known as getting a second opinion. You can do this by asking another specialist to review all the materials needed and related to your case. Doctors who give the second opinion may agree with the treatment plan proposed by a first doctor, or they may suggest changes or another approach. Either way, getting a second opinion may give you more information, answer any questions you may have, give you a greater sense of control, help you feel more confident, knowing you have explored all your options. Getting a second opinion is very common. Yet some patients worry that their doctor will be offended if they ask for a second opinion. Usually the opposite is true. Most doctors welcome a second opinion, and many health insurance companies pay for a second opinion or even require them, particularly if a doctor recommends surgery. When talking with your doctor about getting a second opinion, it may be helpful to express that you're satisfied with your care, but want to be certain you're as informed as possible about your treatment options. It's best to involve your doctor in the process of getting a second opinion because they would need to make your medical records, such as your test results and x-rays, available to the doctor given a second opinion. You may wish to bring a family member along for support when asking for a second opinion. If your doctor can't suggest another specialist for a second opinion, many of the resources listed above for finding a doctor can help you find a specialist for a second opinion. You can also call NCI's Cancer Information Center at 1-800-4-CANCER or 1-800-422-6237 for guidance. This is for the United States. Here in India, you have similar references. I'll arrange to get these references and post them here so that you can use it in India too. We have lots of cancer centers, and like the RCC, the Regional Cancer Center, and the Postgraduate Center for Research, PJ Chandigarh, and the Sri Chitra Institute of Higher Research in Trivandrum. And so many institutes like that are there, right? The Apollo hospitals, right? Now, choosing a cancer center or hospital. As with choosing a cancer doctor, your choice of cancer center or hospitals may be limited to those that take part in your health insurance plan. If you have already found a doctor for your cancer treatment, you may need to choose a cancer center or a hospital based on where your doctor practices, or your doctor may be able to recommend a facility that provides quality care to meet your needs. And these are some examples of questions to ask when deciding where to go for cancer care. Like, does it have experience or success in treating my condition? Has it been rated by state, consumer, or other groups for its quality of care? How does it check on and work to improve its quality of care? Has it been approved by nationally recognized accrediting bodies such as the ACO's Commission on Cancer and or the Joint Commission? Does it explain patients' rights and responsibilities? Are copies of this information available to patients? Does it offer support services such as social workers and resources to help me find financial assistance if I need it? So some examples of questions to ask when deciding where to go for cancer care are below. Does it have experience and success in treating my condition? Has it been rated by state, consumer, or other groups for its quality of care? And how does it check on and work to improve its quality of care? Has been approved by nationally recognized accrediting bodies such as the ACOS Commission or Cancer and or the Joint Commission? Does it explain patients' rights and responsibilities? Are copies of this information available to patients? Does it offer support services such as social workers and resources to help me assist financial assistance if I need it. Is it conveniently located? If you belong to a health insurance plan, ask your insurance company if the facility you're choosing is approved by your plan. If you desire to pay for your treatment yourself because you choose to go outside of your network or you don't have insurance, discuss the possible costs with your doctor beforehand. You will want to talk to the hospital billing department as well. Nurses and social workers may also be available to give you more information about coverage, eligibility, and insurance issues. The resources may help you find a hospital or cancer center for your care. NCI's Find a Cancer Center provides contact information for the NCI-designated cancer centers located throughout the country. The American College of Surgeons or Commission on Cancer has a researchable database of cancer care programs they have accredited. The Joint Commission evaluates and just a second. So the Joint Commission, it evaluates and accredits healthcare organizations and programs in the United States. It also provides guidance about choosing treatment facility and offers an online quality check. Right? Service that patients can use to check whether a specific facility has been accredited by the Joint Commission and to view its performance reports. And for more information, you can always log on to NCI's Cancer Information Center, right? And getting treatment in the United States if you're not a U.S. citizen. Some patients who live out of the United States may wish to obtain a second opinion or have their cancer treatment in this country. Many facilities in the U.S. offer these services to international cancer patients. They may also provide support services such as language interpretation or help with finding lodging near the treatment facility. So these are all additions about treatments. So if you need any such assistance, you can always place your request as well on the comment section of my YouTube lecture. I'll be happy to help, right? And you have to find a resource near your country. You may send the UICC an email or contact them at the Union for International Cancer Center, 62 Rue de Frontenay and 1207 Geneva, Switzerland, plus 41 22 809 1811. You could use it for your benefit. Finding health insurance, then home care services, right, and getting financial assistance for home care. That's all. The related resources would be cancer clinical trials and National Institutes of Health, clinical centers, and need help for finding supports. All this has been updated 20th of August 2024. So that's about those details. We're going back to the subject matter proper for more details. Before I just wind up on that, please read this. If you would like to reproduce some or all of this content, see reuse of NCI information for guidance about copyrights and permissions. In the case of permitted digital reproduction, please credit the National Cancer Institute as a source and link to the original NCI product using the original product's title. Example, Finding Cancer Care was originally published by the National Cancer Institute. So this is specifically being read here because you need to give all credits to the NCI. And want to use this content on your website or other digital platform, our syndication services page shows you how, right? And I'm just showing all this so that you're well informed of what exactly all this is about and how it's being done, right? And syndication services, let's see that. You get to know those details as well. Syndication services, I'm just slowly moving it through so you get to see how it is. And it's a syndication storefront, the excellent dissemination of FTP, all the information systems, information summaries, terms, all about the NCI. If you're interested in using the external dissemination via FTP, please email us at NCI-content-dissemination@nih.gov. That's content distribution partners, all right? So I think I've informed you everything about the official aspects of it. This courtesy, thank you to National Cancer Institute at the National Institutes of Health. You can always contact them at the live chat 1-800-4-CANCER and ClinInfo at nih.government. Site feedback, follow them on these. Courtesy and thank you so much to the U.S. Department of Health and Human Services, National Credit Institutes of Health, National Cancer Institute, USA.government, all credits to these bodies, right? So this is where things stand, and we are slowly winding up on this portion of the lecture, and the next lecture will follow soon. Till then, thank you for listening, and I'll get you across as early as possible now, and we'll give a follow-up on details of each cancer